This webinar is produced and published at the U.S. taxpayer expense. And now I'll hand it over to AmeriCorps.
Good afternoon, and thank you for joining today's Public Health AmeriCorps grant announcement. I'm AJ Perlman, the Director of Public Health AmeriCorps, and I will be your MC today. We are thrilled to announce today millions of federal dollars in Public Health AmeriCorps grants that are going to support organizations to expand capacity in local public health settings, build pathways to public health careers, and drive more equitable health outcomes. Today, we will hear from AmeriCorps, from our partners at the Centers for Disease Control and Prevention, elected officials, and AmeriCorps grantees. And with that, I'd like to introduce an incredible national service champion, our 8th CEO of AmeriCorps, Michael D. Smith, to say a few words. Michael?
Hello, everybody. Thank you, AJ, for that very kind introduction. And thank you to everyone for joining us today as we celebrate millions of federal dollars being invested in national service to strengthen our country's public health systems. Allow me to bring greetings and gratitude on behalf of President Biden, the Biden-Harris administration, and our entire AmeriCorps network of members, senior volunteers, alumni, and staff. Without question, our response to current public health challenges will be one of the defining moments of our time. COVID-19 pulled back the curtain on capacity and equity issues in our public health systems, but we know that these gaps have persisted long before the pandemic. One study by the de Beaumont Foundation and the Association of State and Territorial Health Officials found that state and local health departments need to hire 80,000 more people to adequately provide core public health services, 80,000. This enormous challenge presents an even bigger opportunity and reimagine a public health workforce that is more diverse and more inclusive. Secondly, it presents an opportunity to create career and skill building opportunities for people from all backgrounds with different levels of formal education. And lastly, it presents an opportunity to drive more equitable health outcomes in communities across the country. This is what Public Health AmeriCorps is all about. On day one of the Biden-Harris administration, President Biden urged one of our esteemed guests on the call today, AmeriCorps launched Public Health Equity and to address our urgent public health needs. Through Public Health AmeriCorps, we're committed to two important goals. First, we're going to help to meet public health needs of local communities. And second, we're going to provide pathways to public health related careers to members who reflect the communities in which they serve. Over the last year, we've been able to bring over 1,500 AmeriCorps members and more than 545 locations. Members are working on issues around access to care, nutrition, health benefits, enrollment, responding to gender-based violence, and so much more. And this year, we are proud to announce that we are releasing nearly $90 million in federal funding to grantees that are advancing local public health solutions. These grants will support 107 grantees and approximately 4,300 Public Health AmeriCorps members who will serve in nearly all states and all territories. Members will serve in local health departments, nonprofits, community clinics, and other key public health settings across the nation. I'm excited to hear from two of these grantees in just a few moments. As a result of their service, Public Health AmeriCorps members supported by these grants are eligible for more than $21 million in AmeriCorps Siegel Education Awards. And that's going to help them pay back loans or continue on in their education. So together, in collaboration with the CDC, our local partners, and thousands of AmeriCorps members, we're meeting three important needs. We're working to ensure the communities across the country can address their most pressing health challenges. We're breaking down barriers to public health careers by providing hands-on experience, training, and skill building opportunities beyond the traditional four-year college degree track. And we're helping to build a more equitable workforce, one in which more young people from all backgrounds will be able to access a valuable and meaningful career in public health. So thank you for joining us on this journey. And now I have the pleasure of introducing my colleague, Dr. Les Dolphin, the CDC's Director of the National Center for State, tribal, local, and territorial public health infrastructure and workforce. Dr. Dolphin, please join us.
Thank you, Michael. And thank you to our wonderful partners at AmeriCorps for having us here today. We are so excited to be teaming up with AmeriCorps again to announce the second round of grant awards to state and local organizations. Public Health AmeriCorps is critical to ensuring we have the people, the services, and the systems needed to promote and protect the health of every U.S. community. We saw the COVID pandemic impact every local community, every town, every tribe, every territory, every part of our country. The COVID-19 pandemic showed us that we needed more trained public health staff in all communities to meet the demands of not only a prolonged pandemic response, but also to handle the unique health challenges that were happening in communities around the country. Public Health AmeriCorps came at just the right time when communities needed extra staff or boots on the ground to juggle the competing priorities of recovering from a pandemic and while also addressing the health outcomes that came from that, such as the mental health issues, blood pressure control, food sustainability, and basic health services. The Public Health AmeriCorps program leverages the expertise of CDC and AmeriCorps, capitalizing on AmeriCorps' experience managing some of the most prominent public health service and workforce development programs in the nation, while benefiting from CDC's technical expertise at the country's leading public health agency. Public Health AmeriCorps is also creating new career pathways out of local communities. The program is recruiting individuals into careers in public health, some who may have never previously considered public health as a career choice. Public Health America allows communities to recruit locally so organizations can hire staff who know and represent the communities they serve. And the work of Public Health AmeriCorps staff are doing is not only helping communities now, but training workers and putting systems in place to help communities prepare for future health threats. Let me tell you some of the incredible work that is happening around the country. In rural areas in 26 states, Public Health AmeriCorps is helping health centers and community organizations be able to provide blood pressure control and cardiovascular health services. In Southern California, Public Health AmeriCorps is engaging in community outreach, health education, and infectious disease investigations in the most highly impacted communities located within Los Angeles County, California. They are also working to create programs for populations who have been historically underserved and underrepresented. In Maine, Public Health AmeriCorps is providing community health workers with epilepsy services and health education in 16 hospitals and healthcare institutions. In Idaho, Public Health AmeriCorps is increasing suicide prevention. In Washington, D.C. and 13 other states, Public Health AmeriCorps is helping meet critical nutritional needs of children in schools that have high rates of students who are eligible for free or reduced price meals. And right here in the great state of Georgia, where I am today, Public Health AmeriCorps is providing community health outreach in communities in central Georgia. They are focused on reaching people who have not previously had access to public health. So Public Health AmeriCorps is not only recruiting people to work in public health who might not have considered public health as a career. This program is also extending public health in communities where there might not currently be public health services. Public Health AmeriCorps is helping CDC and our state, tribal, local, and territorial health departments extend our reach. The program is a win-win. Our local organizations are able to provide critical public health services while also recruiting workers into the public health field. Lastly, I want to end with an ask. If you or someone you might want to give back to community, my ask for you is to join us. Go to Public Health AmeriCorps website, apply for one of those amazing service opportunities, Public health needs your talents, your energy, and your skills. And the best part is you can make a difference in your community right now. Thank you. And I am pleased at this time to turn it over to the Director of Public Health AmeriCorps, our partner, AJ Perlin. Over to you, AJ.
Thank you so much, Dr. Dolphin. Thank you to Michael as well, and to all of you for joining us today. This is a really incredibly exciting moment for Public Health AmeriCorps as we celebrate year 2 with millions of federal dollars being invested in this innovative program that sits at the intersection of public health and national service. Our partners, as you heard from Dr. Dolphin, comprise local community-based organizations, national nonprofits, local health departments, state and local governments, universities, and tribes. They are providing much needed services, which Dr. Dolphin also touched on, whether that's nutrition education or mental health supports, to opioid screening and counseling services, to chronic disease education and management, STI prevention, domestic violence response, and more. This diversity is intentional. Public health all of the public health needs that are most important. And now we have the opportunity to further grow this program as we celebrate grant awards to 107 partner organizations who will serve in nearly all states and territories. As Michael mentioned, this year, AmeriCorps and the CDC are investing nearly $90 million to fund thousands of Public Health AmeriCorps members. You'll get to hear from 2 of these organizations today, both Equal Heart and the Los Angeles County Public Health Department. Through Public Health AmeriCorps, we are working in partnership with the CDC to recruit the next generation of public health leaders. We're doing this so that we can build a public health workforce that can meet the demands of communities across the country, and so that people from diverse backgrounds and different levels of education can have a pathway to good jobs in the field, and so that the people who are providing much needed care represent the communities that they are serving. Members serving with Public Health AmeriCorps do not need to have any previous public health experience or higher education to serve. The main requirement for the program is that you have to be 17 and you have to be willing to learn and serve in a hands-on environment. Members receive trainings from the CDC and other public health experts. They receive a living allowance, an education award at the end of their year of service, and access to other opportunities that can prepare them for the public health workforce. For example, AmeriCorps members across the country are being trained as community health workers. They're earning certified nursing assistant licenses. They're learning how to use data informatics in clinical settings, and they're providing health education to communities. This is a critical moment for public health in our country, and I am really excited about the step forward we are taking today to tackle our community's most pressing needs while building that next generation of public health leaders. With that, I am honored to introduce Dr. Kevin McNair, CEO and President of Equal Heart, a longtime AmeriCorps partner, and this year, a first-time Public Health AmeriCorps grantee. I will now pass it over to Dr. McNair.
Thank you, AJ. As AJ said, my name is Dr. Kevin McNair, and for the past 7 years, I've had the honor to lead Equal Heart, which is headquartered in Dallas, Texas. And a special thank you to Representative Crockett for your support of national service and representing Texas here today. Equal Heart's overall mission is to support people in times of adversity. Operationally, that means we strive to increase resources and access to those resources in vulnerable communities. Although new to PHA, we have benefited from operating an AmeriCorps program for the past 6 years, which provides funding and support to almost 40 nonprofit partners, all located in high-need areas across 16 states. Our goal is to expand their capacity and thus increase the reach and impact of their local programs. We're excited to be a first-time grantee for Public Health AmeriCorps, as it allows us to deploy dedicated funding focused solely on health equity outcomes in 8 communities located in 5 different states. AmeriCorps members serving with Equal Heart have the option to serve in a number of public health settings, including one of 2 city health departments located in Texas, a community health center in either Texas or Hawaii, or one of our 4 community nonprofits focused on increasing access to healthy food. These are located in the Smoky Mountains of Tennessee and Virginia, and the Eastern Plains of Colorado, and in Southern Texas. Each of these nonprofits are facing serious challenges with capacity. In short, we need more hands on deck. AmeriCorps members will build capacity through community assessments, recruiting and training, and managing volunteers. They will also provide a range of direct services determined by the needs of the local community. These will range from connecting community members with a primary care physician to providing families with a stable source of food. One example I want to highlight is the work of our community partner, South Texas Juvenile Diabetes Association. They are located in the Rio Grande Valley on the Texas-Mexico border, and they currently operate a series of summer programs for children with diabetes. This allows children to have a safe space during the summer months, to interact with other children living with diabetes, and allows for an education program for managing the disease. With the addition of AmeriCorps members to the Public Health AmeriCorps grant, they will be able to expand their program beyond summer, to develop and implement after-school programs, and to expand their education efforts to focus on preventative measures to decrease the overall incidence of diabetes in their community. Huge thank you to AmeriCorps and the CDC for making this critical funding available, and we look forward to our continued partnership.
Thank you so much, Dr. McNair, for all you do. I think, hold on, my mic isn't plugged in here. That would be helpful. McNair, for all that you do, all that your teams do and your AmeriCorps members do, and will continue to do for communities. And congratulations on your first Public Health AmeriCorps grant. You know, I've had a chance to see your work up close and personal, and I am so glad that we have you as a partner because the work that you do is truly transformative. I am now honored to introduce Representative Jasmine Crockett, who serves Texas's 30th district, which includes Dallas and Tarrant counties. She is a champion of service and protecting the civil liberties of those in underrepresented communities. Congresswoman, thank you so much for being here today. Would you like to say a few words?
I've got a noise on my end. I hope there's not a noise on y'all's.
We can hear you okay.
Okay, perfect. Well, thank you, Michael, AJ, and all the staff of AmeriCorps for supporting local nonprofits that build up communities and change lives, like Dallas-owned Equal Heart. The work of Public Health AmeriCorps in North Texas is life-changing and community transforming. I couldn't be more grateful for the work you and your volunteers do to address healthcare and nutrition inequity for our most vulnerable Texans. The organizations you support are quite literally saving lives, filling in the gaps in our social safety nets, and moving us away from being a food desert to a food oasis. Today, I'm proud to help announce a let's say just 7, but it's actually under that, but a little bit more than $2 million federal investment in an organization based in my district, Texas 30, for Equal Heart. For many food insecure children and families in my district, the work Equal Heart does to get food assistance to people who need it straight to their homes is quite literally the difference between a child getting fed and going hungry. To the many Dallas area students who depend on free or reduced lunch every school year, summer break, that can be a very hungry time. Sorry about this. This noise is driving me crazy, but I'm glad y'all can't hear it. But thanks to Equal Heart, working parents don't have to worry about how to feed their kids over the summer while they're at work, and kids can focus on having fun rather than finding the next meal. Summer's coming up fast, and inflated food costs are going through the roof, and we've got an ongoing supply chain issue and greedy corporations that are putting profits over people. Parents in my district are worried about how they're going to get food to the table, 3 meals a day. Equal Heart makes their lives a little easier and helps bridge the nutrition gap until school starts again. There's a lot to do to fix food insecurity in America, but the work you do helps families when they need it the most, and they need it right now. So thank you for all you do, and know that you have my support. You've got Dallas families' backs, and I've got yours. Thank you again.
Thank you so much, Congresswoman Crockett. We really appreciate your time and your support of national service and public health, which is critical to our success in Texas. We'll now hear a few words from Texas Senator Sen Cornyn.
Hi, I'm Texas Senator Sen Cornyn. Thank you to AmeriCorps for hosting today's press conference and for giving me a chance to say a few words. I was glad to hear more than $6 million will be awarded to Texas organizations to fund more than 300 AmeriCorps members. Organizations like Equal Heart in Dallas serve the health needs of many rural communities who are often underrepresented. I want to thank everyone at Equal Heart for working to provide the resources necessary to fight hunger, support students, and improve health outcomes. Congratulations to all of this year's grantees, and keep up the great work.
Thank you so much to the Senator for those kind words and for your support for national service in Texas as well. I am now pleased to introduce our next speaker, Fareed Howard. Fareed is a Public Health AmeriCorps member serving in my hometown with the Los Angeles County Public Health Department. This is LA County's second year as a Public Health AmeriCorps grantee. Congratulations, and we're thrilled to hear a bit more from Fareed about your service. Fareed, the floor is yours.
Hello, everyone. As AJ said, my name is Fareed Howard, and I've been an AmeriCorps member with the Los Angeles County Department of Public Health for the last 5 months. I was inspired to join AmeriCorps for the opportunity to gain experience in the field of public health in the hopes that I can work to improve the health of my community. The start of the COVID-19 pandemic allowed me to recognize the important role public health professionals play in controlling the spread of disease and keeping the public informed. The goal of the LA Public Health Department is to advance the conditions that support optimal health and well-being for all, especially when we know that not everyone has the same access to care or resources to afford that care. This is our second Public Health AmeriCorps grant. Partnering with AmeriCorps allows the department to increase their staff capacity by onboarding and training members like me who can help amplify public health messaging and support priority communities across LA County. The communities I serve in metropolitan LA are highly diverse with varying needs. We provide targeted outreach and support to communities disproportionately impacted by the pandemic and chronic disease. One of the challenges associated with working with a large government entity is that it takes time to gain community members' trust. AmeriCorps teams have been pivotal in bringing resources to the community and meeting community members where they are at. For example, I recently had the opportunity to serve at the Skid Row Black History Month celebration in San Julian Park. Skid Row is an area of downtown Los Angeles with one of the largest populations of people experiencing homelessness in the United States. We didn't show up with reading materials, ask anyone to provide personal information like their full names or contact information, or require advanced sign-up. Instead, we leveraged community local partnerships to introduce us to residents, shared COVID-related information without being forceful or judgmental, and we taught hands-only CPR, a critical life support skill that was urgent and relevant to the health risks persistent in this community. Not only was this my first time working in Skid Row, it was my first time helping to implement a health intervention that works to empower members within my community and increase the chances of saving a life in an emergency situation. Last year, through Public Health AmeriCorps, the department enhanced the existing community engagement infrastructure and supported communities disproportionately affected by COVID-19. From December 2022 to April 2023, AmeriCorps teams have reached more than 13,000 community members countywide through outreach efforts. With this year's grant, we can continue on these efforts. Personally, I am most looking forward to working with my supervisors and fellow AmeriCorps members to continue to promote COVID-19 safety in our communities, expand hands-only CPR training for residents, and increase overdose prevention efforts in Los Angeles County. Thank you for the opportunity to share more about our impact. We are excited to be a 2023 grantee for Public Health AmeriCorps.
Fareed, thank you so much for telling your story, for talking a little bit about the work that you and other Public Health AmeriCorps members are doing with LA County. I also want to thank each of our speakers today for their thoughtful insights during the event and for your enduring work to rebuild and restore our public health workforce, to drive more equitable health outcomes across the country, and to leverage the power of national service to get things done for America. If you are a member of the media, please reach out to AmeriCorps' press office with questions and press inquiries. The email address is up on the slide. Thank you so much, and I hope that all of you have a great rest of your day.